This study evaluated the effectiveness of nutritional therapy in the McClellan Teaching Clinic at the University of Worcester. My name is Miranda and I'm Senior Lecturer on the Nutritional Therapy Master's course at the University of Worcester. I've taught widely across the course since 2013 and currently lead the research and dissertation modules with a special interest in quantitative and meta-analysis methods. I'm a registered nutritionist with interest in sports nutrition and a member of BANT, CNHC and the FHEA.
Hello, I'm Alison. I'm a practitioner and I'm an accreditation assessor for the Nutritional Therapy Education Commission, where I'm also a member of the board. I also represent nutritional therapy as a professional standards boards member for the CNAC. I'm course leader for the Nutritional Therapy Masters at Worcester. I'm a BANT fellow and I'm also a fellow of the Higher Education Academy. So the aim of this project was to measure and evaluate the effectiveness of nutritional therapy in a teaching clinic using MyMOPS, the Measure Yourself Medical Outcomes Profile tools, and the Working Alliance Inventory, or WAI tools. There are two of these, one for the therapist and one for the client. The objectives of the project were to investigate the relationship between the student therapist and the client using the Working Alliance Inventory for the therapist and one for the client. Also to evaluate the effectiveness of nutritional therapy, comparing MyMOP at initial appointment and MyMOP at follow-up. And then to predict the potential outcome of nutritional therapy using the WAI tools and the MyMOP.
MyMOP is a patient client-centered outcome measure, which was originally designed by primary care practitioners and since used in complementary healthcare, including nutritional therapy. This objective measure, which is quick and easy to complete in a consultation, enables the client to focus on aspects of their health and identify factors for change, thus facilitating a more client-focused relationship. The client identifies two specific health complaints or symptoms which have been present over the past week, one activity limited by the symptoms, and a general well-being score. The client repeats this process at follow-up using the MyMOP follow-up without sight of the previous scores of MyMOP. MyMOP profile scores are calculated by averaging the 4 item scores, which can be compared over subsequent consultations, with the items measured remaining the same. The Working Alliance Inventory is a validated measure used to assess the quality of a therapeutic relationship between therapist and client using 2 questionnaires. WAI therapist and WAI client, which is considered to predict successful therapeutic outcomes. It assesses 3 key elements: agreement between therapist and client on the goals of therapy, consensus on the tasks of therapy to address the issues identified by the client, and development of an effective bond between the 2 parties.
So ethics, permissions and participants. Before we started, this project had full ethical approval from the University of Worcester before students and clients were invited to take part. And we also had permissions to use both the instruments. So the students were recruited from the McClellan Teaching Clinic over 2 semesters. These were students currently doing their clinical practice module. And clients were recruited from the University of Worcester and the general public. In total, we had 55 clients and 22 students. The mean client age was 44.2, and it ranged between 19 to 72, with 48 females and 7 males, a demographic most of us working in complementary medicine or integrative medicine will be familiar with. The most common reported symptoms were digestive issues and low energy. The length of time reported for symptom 1 ranged from 4 to 12 weeks to over 5 years, with the greatest number reporting symptoms of over 5 years. The activities affected by symptoms included social activities, general activity performance, and exercise performance. Of the 12 taking medication, 6 wanted to reduce this. And you can see from these two diagrams here, the one on the left illustrates the length of time for symptom 1, and the majority were over 5 years, as you can see here. And again, on the right, the MyMOP activity, this jump from 1 to 2 participants for all the other categories to 11, 12, and 13 for exercise, performance, activity, and social activity.
Objective 1, which was to investigate the relationship between the student therapist and the client using the WAI for therapist and client, showed that the mean scores for both WAI therapist and client, when calculated at initial 1 and follow-up, were used to measure the strength of the relationship of the working alliance. Scores demonstrated a strong working alliance for the therapist and the client at both initial 1 and follow-up. A statistically significant improvement was seen between initial 1 and follow-up in both the WAI therapist and the WAI client with large effect sizes.
And objective 2 was to evaluate the effectiveness of nutritional therapy comparing MyMOP and MyMOP at follow-up. The mean scores of symptom 1, symptom 2, activity and well-being were calculated at initial and follow-up. And what we found was a statistically significant improvement seen between initial and follow-up. Symptom 1, symptom 2, and activity, all with large effect sizes. Plus, we also found an improvement, but no statistical significance was seen in well-being.
Finally, we wanted to predict the potential outcome of nutritional therapy using WAI and MyMOP. So the mean scores of symptom 1 and symptom 2 were combined and calculated at initial 1 and follow-up. Relationships then looked at the mean scores of the WAI client and the WAI therapist and the differences in those combined scores of symptom 1 and 2 between initial 1 and the follow-up. We found that there was a medium positive relationship between WAI therapist and the differences in symptoms 1 and 2 between initial 1 and 2, and a small positive relationship at follow-up. Small positive relationships were also found between WAIC, both initial and follow-up, and differences in symptom 1 and 2 combined scores between initial 1 and follow-up, respectively. These results do show a positive working alliance is associated with improved symptoms. However, none of these relationships reached statistical significance. So,
in conclusion, the aim of this project, one of the other aims, was also to contribute to the evidence base for nutritional therapy. So to sum up, the pilot study has demonstrated the effectiveness of nutritional therapy as an evidence-based therapy for health and lifestyle improvement. The 2 validated measures used in the study have predicted nutritional therapy efficacy by the strength of the working alliance between the therapist and the client. And these results can be transferable to other areas in integrative medicine.
Whilst acknowledging the limitations of the pilot, we also acknowledge that further research would be very helpful to contribute to the evidence base for nutritional therapy, but using larger sample sizes. Please come and see us in the coffee breaks, or if you have any questions, please email either Miranda, myself, or Alison on those email addresses. Thank you very much.